that forced me to think outside the box immediately. I never forget one of my first patients, first name was Tammy. And her husband brought her in, carried her in. She was emaciated. She could hardly talk. So, you would ask her a question and she could hardly whisper, but her husband was able to say, is there anything you can do to help my wife stay alive, to get well? And, and I'm just thinking, this lady can't eat. She can hardly speak. She's lost so much weight that she's so weak. So what can we possibly do? We know a lot about diet. We know a lot about nutritional supplementation. We know that forced me to think outside the box immediately. So that's when the intravenous therapeutics began, even before they were popular in Washington State. Okay. So I was doing it before a lot of people. It wasn't even in our scope of practice, but I was doing it. A lot of people were helped. And then one beyond that was like even getting to the personalized movement of identifying the problem. So that's where we started working on identifying what cancers were demonstrating what type of patterns. And we were isolating these things out in the urine, which are known as peptide fragments. So we isolated these fragments out and we purified these fragments that identified what they were. And, but even before we identified it, we were just giving the patients back their peptide fragments, that were, part of their treatment plan. And these patients miraculously began to get better and their tumors began to shrink and their metastases began to go, down quite significantly. And a lot of patients cleared the disease. Like within a year, patients were clearing diseases this way.